Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to show you how you would test for vitamin D at home. So we're going to use this kit we bought on Amazon. It's by a company called Everlywell. And there's a couple different companies out there, but basically you order this kit on Amazon or Mercola.com or the Vitamin D Society, and they send you this kit. And what you can do is you're going to prick your finger, you'll put your couple droplets of blood on the test card there, and then you mail it in. And then in about 7 to 10 days, you'll get the results back to see where you're at with your vitamin D levels. Obviously, the best way to test your vitamin D is to get a blood drawn at like LabCorp or Quest Diagnostics, but this is a real easy way, and you can monitor this throughout the year. I'll do this every 3 to 4 months to see where my vitamin D levels are. And now with COVID-19 going on, it's very important to get your vitamin D levels into a healthy range. There's a lot of research showing that if your vitamin D levels are in a normal healthy range, it significantly reduces your risk of dying from the virus, and it also helps prevent a lot of the negative symptoms that you get with COVID-19. So I highly suggest you get this tested because most people don't even realize they are severely deficient. If you are severely deficient, you can get a prescription level of vitamin D. It's typically about 50,000 IUs, and you take this once a week to get your levels back up into that normal range. And then what I would suggest is you take about 5,000 to maybe an 8 to 10,000 IUs of vitamin D daily, and that's going to help to maintain your normal vitamin D levels. And then obviously every 3 to 4 months you can test it out and you can make sure you're in that normal range. In this video, I'm going to show you how you'd apply the vitamin D kit at home. So now we have the test kit set up. What we're going to do is we're going to prick our finger, and then we're going to put a couple droplets of blood on the card, and then what we're going to do is they give you this little package. You're going to send the test card back in, and then like I said, usually about 7 to 10 days they will have the results and you can view that. So let me just see your finger. I'm going to just clean off. She's already washed her hands, but we'll just prep it one more time there. Good. And then what we're going to do, good. And we're just going to squeeze her finger just to kind of get the blood to pool there. Good. And it says you want 4 large drops. Okay, that's going to be enough. So that's how you do the test. It's real simple. Like I said, once you get the several droplets of blood on there, you'll see it reach a certain level. And then, like I said, you just mail it in. And that's that simple. And like again, I'll do this anywhere from 3 to 6 months, but typically it's been about every 4 months or so. And then as you take your dosage, you'll be able to see that levels kind of maintain or slightly increase. If you're on the prescription level, your doctor will monitor this with blood draws, and they'll make sure, because the 50,000 is quite a bit of vitamin D to be taking. And usually you take that for about a month, and then that's enough to kind of get your levels up to a normal level, a healthy level, and then you'll just maintain it with the daily vitamin D. And while we're speaking about vitamin D, the vitamin D that I recommend for patients is vitamin D3. And ideally, you want to find a vitamin D3 that has also combined with K2. So K2 helps the absorption of the vitamin D, and then also is improved with, so vitamin K is involved with clotting. And so one of the things we're seeing with COVID-19 is there's a lot of clotting issues with patients. And so it will help with clotting problems that are another side effect of the COVID-19. But I highly recommend you get this tested. Most of my patient base, I would say close to 80% are deficient. They don't even realize it. There's so many research studies showing it's involved in not only COVID-19, but also bone health and so many other diseases and processes throughout the body that it's vital that you get it tested. If you have any questions, reach out to me at 703-912-7822, or you can schedule online at novachirowellness.com.